This is a full view. Welcome back. Now, 59% of South Africans who have TB also have HIV. And most deaths among people living with HIV are due to TB. And to address this, the Department of Health of South Africa has put tremendous efforts into integrating HIV as well as TB services in facilities so that patients can now be tested and started on treatment or preventative therapy as quickly as possible. Dr. Tendani Matoro, Right to Care Senior Medical Technical Advisor, is with us via Zoom to shed more light on this topic. Doctor, as always, thank you so much for joining us. Look, 59% is way too high a statistic in terms of TB in relation to HIV infections in the country. This right at the back of the recent announcement that STIs had increased among men in the country too. Where are we failing the masses? Who is failing the masses?
Good evening, and thanks for having me. You are definitely right. It is quite a high percentage that people that are HIV positive have a very high likelihood of getting TB. Mm-hmm. Now, if one were to sum it up quickly, it all boils down to what our bodies can do and what they can't do. So if you look at some of our soldier cells, the CD4 cells, as we call them, their numbers and their functionality actually is what seems to make people who are HIV positive more prone to getting TB. And you also speaking about STIs, the risk of getting STIs with HIV can also be seen to be high. So the question of who's failing whom, I think that would be a very tricky question to answer. But what we can say is that there is quite a lot that is being done at the community level, at facility levels, where people are being tested, after being screened for these conditions, TB as well as STIs, and effective treatment is being initiated. So I think it also goes back to what can we do together, as the Department of Health and as the communities.
Now, Doc, look, this initiative to integrate testing as well as treatment facilities, right? Do you foresee it yielding positive fruit? I mean, the message has always been there that if you test for the one, you have to automatically test for the other one.
So I think that speaks to how well our facilities can offer those services to patients, which is what we call integration. Yeah. So, for example, as Right to Care, working with the Department of Health, we do provide with what we call risk screening tools that allow whoever is seeing patients as they come into the facility. So what we call part of being screened would basically go through various questions for STIs, TB. They can actually also screen for intermittent partner violence and, alongside doing things like your blood pressures, your temperatures, as you know how they do at the clinics. So meaning that you are getting all the services at one go. And that also speaks to when you do go into a consultation room, you should be able to get all those services being offered as a comprehensive package. So if we look at the effectiveness of those services, I think it does depend as well also on how well are we presenting to facilities and how well those services are being rendered at the time when you are there. But as far as I can say, we are making great strides in making sure that those things are done effectively.
All right. And Doctor, are you collaborating with the Department of Health? And also, maybe please address this. Is there a certain demographic, according to your observation, gender or even race that is more affected by these latest statistics? And what have been your observations as to the main causes of the scourge?
No, 100%. As Right to Care, partner funded by the USAID, we are working very closely with the Department of Health. And what we do see is that there is a high-risk group that seems to be more likely to getting TB. And healthcare workers, surprisingly, are also part of that high-risk group. You can also look at people that are in very overcrowded areas. But the biggest thing that we know about TB is that there are multiple social determinants that actually determine, who gets TB, when or how. So, the biggest problem that one can say is that we need to find ways of addressing these social ills, because we know that poverty is also one of the contributors overcrowding and lack of certain basic needs also do perpetuate people getting TB. Now, if we look specifically at people who are HIV positive, and if we try to pin it down to saying who is more likely to get TB, it will usually be whoever presents late, whoever is not doing well on their treatment, and we can also look at people that are not being well screened when they do visit facilities.
Very quickly, Doctor, now TB is preventable and curable, and this means that no one should die from it. So take us very quickly through some of those preventative measures as well as treatment options and some symptoms.
Yeah. So when it comes to preventing against TB, I think there is a lot we can learn from developed countries in how they manage to control TB. Eradication of TB, is another story, because even biologically TB is quite a resilient bacteria that refuses to give up. However, if you look at what you and I can do in our own spaces, if we are living with someone that's diagnosed with TB, we always need to make sure that we also go get checked. We need to get screened. There are questions that they ask us, and depending on what they see, they can then decide if they are testing us. And thereafter, if one does not have TB, one then gets offered TB preventative therapy that then protects one from getting TB, even if one is living with someone with TB. And of course, you remember the face masks that we used to use during COVID-19. There is still a role for using them in TB if one is living with a TB positive or diagnosed person. And of course, when it comes to the biggest way of preventing TB, is that if we do treat TB, find it early in those that are having TB, then we're able to prevent it from being passed on to the next people. And, we might also talk about issues of vaccines for kids, and there are still other developments around vaccines that can help us protect ourselves against TB.
Thank you so much. That was Dr. Tendani Matoro, the Right to Care Senior Medical Advisor.